Hi Izzy, how are you?
I'm good. How about you?
I'm really good. Thank you for coming in today. So I see on your chart that this is your first time seeing me, okay? And you're here for a 2 p.m. appointment. So you're here for a full head-to-toe exam. Do you have any particular concerns that you'd like to address today?
Yes, my stomach has been hurting.
Okay.
And I'm not sure if it's something in my diet or maybe something else.
So you've been having some abdominal pain. Could you describe the pain more? Is it nausea or like a muscular ache, or is it like a stabbing pain?
Yeah, it's more of a muscular ache.
Okay. Have you been doing any physical activity that's very like taxing, exerting, like lifting heavy things, or did this just kind of come out of nowhere?
I did just run a 5K.
Oh wow, congratulations. That's amazing. Okay, so you're a distance runner. I know that sometimes we can run, I'm a runner as well. Sometimes running long distances in training can be different than the stress of actually doing a 5K. It can take a lot out of you. So when was the 5K?
It was this Sunday.
Okay, so pretty recent. Okay, and so is there a time of day where your stomach issues are hurting more than others? Does it hurt a lot in the morning or at night?
It is more in the morning.
Okay. Do you drink coffee?
I do.
Okay, how many cups a day?
Usually just 2.
Okay. That's a pretty standard amount. Okay, any special diet?
No.
And on a scale of 1 to 10, how would you rate your pain right now?
Right now it'd be like between 7 and 8.
Okay, sorry to hear that. Have you been doing anything for the pain? Taking any over-the-counter supplements or medications?
I take Tylenol.
Okay, does it seem to work?
Sometimes, but not really.
Okay. Yeah, we don't want to take too much acetaminophen. It can really affect the kidneys over time. How much are you taking?
I'll take every 8 hours.
Okay. 8 hours. And how many milligrams do you know?
I think it's 50.
Okay, that's not bad at all. Okay. So aside from that, any other issues?
I have been having some toothaches.
Okay.
And it's not when I'm eating, it's like just when I'm not eating.
Mm-hmm. Okay. Is there a side of the mouth that it's hurting more on, or a particular tooth?
It's definitely the left side.
The left side, okay. Sometimes it's tricky to pinpoint which tooth is hurting, so it's just generally on your left side. I saw you kind of indicating upwards, so is that on your upper mandible?
Yep.
Okay. Okay, so with that in mind, I'm just going to ask you a few questions about your family history of medical issues, disorders, conditions. So just let me know if anyone in your immediate family has hypertension.
Yes, my dad.
Okay. Lung disorders?
No.
Okay. Blood disorders?
No.
Okay. Any history of high blood pressure?
Yes,
okay.
Most of my family.
Okay, yeah. Okay. What about any muscular issues in your family?
No.
Okay. Issues like dementia, Alzheimer's?
Yes, my grandpa.
Okay. Neurological problems?
No.
Okay. Okay, and can you also verify your date of birth?
7/11/02.
Okay, so we got great. All right, so I'm going to go ahead and take your vitals, and then we'll just move on to you laying down on the bed. I'll examine your stomach, and I am not a dentist, but I'm going to give you just a very light examination of your teeth so we can send a referral to a specialist or a dentist. Okay?
Thank you.
All right. Going to listen to your heart and your lungs first. Okay, do you mind if I just hair back gently on this side? Great, okay. Good, your heart rate sounds normal. Okay, I'm going to flip over and sit on the bell side. You can just breathe normally, listening for any murmurs or extraneous sounds. Okay, great, no murmurs present. I'm going to listen to your lungs now, so I'm just going to beautiful. Your lungs sound perfectly clear. Just gonna listen on the other side. Excuse my reach. Okay, take one more deep breath for me. Okay, perfect. Okay, I'm just gonna write this down. Any issues with racing heart or dizziness on standing?
No.
Great. Okay. Okay. I'm going to do your blood pressure next. Can I go ahead and have this on? Okay. Perfect. Okay. Make sure your legs are uncrossed. Beautiful. Okay. Your blood pressure is great. It's 110/72, so that's really good. I'll try to slide this off. Great. Okay. Okay. Can you go ahead and get your temperature? Okay, 97.3. And if you could give me your index finger, I'm going to check your oxygenation. Okay. Yes, your oxygenation is 97% at room air, which is great. Your heart rate is 64 beats per minute, which is slightly low, but I think this machine is having some issues today because this happened on a few other patients. So we'll keep track of it for sure. Okay. So next I'm going to palpate your face with my hands. Do I have your permission to touch your face? Okay. You're just going to be feeling gentle palpation, just feeling for lumps or bumps or any abnormalities. Right now I'm feeling your pre-irregular lymph nodes. They're non-palpable. And your post-irregular. Okay. Going down. Tired. Okay, I'm going to touch your neck gently just to feel your thyroid. It's normal in size. Going to feel right under your eyes and your sinus cavities. Any pain when I press here?
No.
Okay, good. Alright. Just going to feel your head for any signs of concussion or lumps. Go ahead and try to raise your eyebrows for me. I'm not going to let you do that. Good. Raise them all the way. Okay, good. Try to lower them. Okay, very good. Very strong reaction. Okay, placing my fingers gently on the bridge of your nose. Try to turn to your left. Good. Opposite way. Good reaction. These are the facial myotones. Next, I'm placing my fingers gently on your cheek. Turn to your left. Okay, good. Turn to your right. Good. Now try to look up at the ceiling for me. Okay, good. And try to touch your chin to your chest. Beautiful. Okay, really good. Just gonna write that down. Okay. Any issues with vision lately, color blindness?
Sometimes I will get like a little bit blurry.
Blurry vision?
Mm-hmm.
Okay. Is this in any particular instance, like when driving, outside, inside, or does it just kind of randomly happen?
Normally it's just after I'm on my phone for a long time.
Okay, yeah, it's probably even better proof than we have that taking breaks from our phone is a good thing. But I'm going to just give you a color test first. Then I'll look inside your eyes and test your vision in other ways. So go ahead and look at this pencil. Tell me what color it is.
Pink.
Perfect. It won't do all of them, just a few.
Yellow.
Good. Is it moving closer or further away from you?
Closer.
Okay.
Away.
Good. Okay, what color is this?
Brown.
Good. Is it moving to your left or your right?
Right.
Good. What about now?
Left.
Okay, wonderful. What color is this?
Magenta.
No. It's red.
Okay.
But that's good information for me. So you think it's magenta. Let's see. Where do you think it's moving now? Up or down?
Up.
Good. Okay. And curious to see what color this is to you.
Blue.
In the light, I can see where you might think it's blue, but it is indeed purple. So I think you might have some color issues. Nothing to be ashamed of. Is it moving to your left or your right?
Right.
Okay, what about now?
Left.
Good. Let's do one more.
Orange.
Yay. Okay. Is it moving further away or closer?
Far.
Good job. Okay. All right, so I'm gonna look inside your eyes now. Okay, just okay, just go ahead and look straight ahead. Visualizing them just with a flashlight. They look very healthy. Don't see any issues with redness, no jaundice, no overactive veins. Your pupils are reacting to light perfectly. They're constricting as I bring the light closer. Sorry if this is a bit uncomfortable. Okay, just gonna look a little bit closer. Okay. Keep picking a point on the wall, and we'll try to make this brief. I don't need to give you the strobe effect. Okay, look to your left, right, up, down. Okay, good. Look to your left, right, up, down. All right, great. Was that painful at all or confusing?
No.
Okay. Your eyes look very healthy. All right, go ahead and look at me. Pick a point. How about the tip of my nose? And let me know when the light enters your field of vision. When it enters your field of vision, say now.
No.
Good.
No.
Good.
No.
Mm-hmm.
No.
Beautiful. Wonderful. Okay, now let me know when it leaves your field of vision.
Leaves.
Leaves. Leaves. Okay.
Leaves.
Good. Okay. Holding up my hands. Which hands are closer to you? The hands on your left or your right?
Right.
Okay, good. Which hands are moving? The ones on your left or your right?
Left.
Okay. Which hands are moving?
Right.
Okay. Which hands are closer?
Left.
Which hands are moving?
Left.
Okay. Which hands are closer?
They're equal.
Good. Which hands are moving?
Both.
Good. Okay. I'm going to give you a Snellen chart. So go ahead and hold this at arm's length if you can. Just stretch your arm out. Perfect. Okay. So go ahead and read that second row for me.
L. T.
What about that row beginning with a D?
D. H. J. B. S.
Wonderful. Go ahead and read that backwards.
S. B. J. H. D.
Mm-hmm. What about the second to last row?
C. F. D. H. J.
Okay. And the last row beginning with the H and ending with the L.
H. P. F. D. L.
Wonderful. And what color is this?
Green.
Great. What color is this?
Orange.
Yeah, I think it's orangish reddish. You got it in the same color family. Okay, I'm gonna hold it now. Which circle is larger, number 8 or number 2?
8.
Okay, number 3 or number 2?
3.
Number 5 or number 9?
9.
Okay, good. Do you wear contacts or glasses?
I wear contacts.
Okay, what's your prescription, do you know?
Yes, and this eye, it's negative 5.75.
Okay,
And
right.
then in this eye, it's negative 4.75.
Okay, all right. So you've got some nearsightedness.
I do.
Okay. How are your contacts working for you? They seem to work pretty well. Any complaints or issues?
Sometimes they dry out.
Okay. Yes, I have. So I can write you a recommendation list of some eye drops that don't have preservatives. I myself, well, I'll give you a couple brands. I don't want to brand the video.
Okay.
But there are certain drops that can help with that because I experienced that myself. Absolutely. Okay.
Thank you.
Yeah. But your vision is pretty good on them?
Yes.
Okay, that's good. Okay. Let's go ahead and check your hearing before we lay down and look at your stomach. Any issues with hearing?
No.
Hearing pretty well. Okay, I'm just gonna go ahead and look straight ahead and just going to. Okay. All right. You've got some wax buildup in here, but nothing that obstructs my view of the tympanic membrane. It looks like a nice pearl gray. No signs of scarring, scratching, damage. Very healthy ear. Okay. And look at the other side. Okay. Go ahead, look straight ahead. Okay. Very healthy ear. Not seeing any issues. Just a little bit of wax buildup that you might want to take care of, but I can still see that the membrane is intact. No signs of an infection. Just gonna look here around the edges of the auricle. Perfect. Okay. Close your eyes. Let me know if I'm pulling down, back, forward, or up on your ears, okay?
Down.
Good.
Up.
Okay.
Up. Towards you.
Great. Close your eyes again. Let me know which sound, which ear you hear the glove rustling sound on, left or right.
Left. Right. Right. Both. Left.
Wonderful. Okay. I'm going to come a little bit closer and just whisper some words in your ear. Repeat exactly what you hear after me, okay?
Okay.
Okay. Muscles.
Muscles.
Blood circulation.
Blood circulation.
Leaves.
Leaves.
Ghost stories.
Ghost stories.
Candles.
Candles.
Perfect. Earrings.
Earrings.
Great. Same thing here. Christmas.
Christmas.
Thanksgiving.
Thanksgiving.
Valentine's Day.
Valentine's Day.
Maple leaves.
Maple leaves.
Spider.
Spider.
Great. Okay. Next, we're going to do a tuning fork exercise, okay? So, you're going to hear this sound, and I'm going to give you two options, A or B. Tell me which option sounds closer to you, okay?
Okay.
All right, let's go ahead. Close your eyes. Good. This is A. Here's B.
A.
Good. This is A. This is B.
B.
Good. Now, let me know if the sound is coming from above your head, below your head, to your left or your right.
Above.
Good.
Below. Below. Right. Left.
Okay. Perfect. I have a couple tuning forks, so I'm going to be making a sound and placing them on different resonance chambers of your face. Here, 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 and perhaps the size of your face. You should feel a vibrating sensation as well as hear it. I want you to let me know when the sound and the vibration stops. And if you only hear it or only feel it, let me know that too. But you should hear it and feel it at the same time. Okay. Okay. So when it stops, say now.
Now.
Good. Okay. Doing the same thing, just with a different frequency. No. 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 Perfect. I think your ears are very much intact and healthy. Okay. Okay, so this is a pressure point test. These are 2 pressure points. This is 1. Close your eyes. Let me know if you feel 1 or 2. Just say 1 or 2. Okay? And it's going to be on your face and your upper body. 1, 2, 1, 2, 2, 1, 1, 1, 2, 2, 1, 2, 1, 1. Perfect. Okay, we're going to do shark or dull. This is a shark. This is dull. Okay. So let me know which one you feel, okay? Shark. Dull. Shark. Dull. Shark. Shark. Dull. Okay. Dull. Good. Shark. Shark. Good. Dull. Good. Dull. 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 Shark. Shark. Dull. Shark. Dull. Shark. Dull. Shark. Dull. Dull. Shark. Shark. Dull. Shark. Shark. Dull. Dull. Shark. Dull. Dull. Good. Shark. Dull. Dull. Wonderful. Okay. So next, I'm just going to have you lay down in the bed, and so I can examine your abdomen, and also we're going to just take a very gentle look at your teeth, okay? All right, okay, Yzzy, just turn your head this way very gently. Just going to take a quick look inside your mouth, okay? But before I do that, I'm going to just administer a little bit of antiseptic mouthwash, okay? So, go ahead and open. I'm going to give you just a little bit here. Go ahead and swish that, make sure you don't swallow. Okay, you can turn your head to your side and you can spit out. Perfect. Okay. Is that all you got?
Yeah.
Okay, good. It's a little awkward, but that's okay. Good. Here. You can go ahead and wipe that for you. Okay. Beautiful. So, I'm going to just go ahead and open your mouth for me. I'm just going to take a look inside here. Okay. See a little bit of black buildup on, should be about T5. Did you have some dental work done on this tooth here?
Yeah.
Yeah, I can see that. Looks really well done. Okay, open. Just going to slowly just do some polishing work here. Just to give me a better visual. Okay. Do you floss regularly?
Yeah.
Definitely looks like I'm not seeing a lot of buildup of food debris. It's really good. Teeth look pretty healthy. You said the aching has been on the left side? Okay. I'm just going to, and again, I don't have all the tools that a dentist's office will have, so I'm going to write you a referral, but I'm just going to take a look here just to see. Okay. I'm just going to use a tool here. Go ahead and open for me. Seeing a little bit of redness here surrounding this tooth. And a tiny brown speck. I'm not sure if that's black or it could be the start of plaque, and there's some redness around the root. So I'm definitely going to get you a referral. The other teeth look really healthy. Your gums look pink and moist. I don't see any signs of dryness or gum disease. Okay, just gonna go ahead and look at these teeth here. Bottom teeth look great. Okay. I'm going to tap gently on the teeth. Let me know if you feel pain, okay? Just say, uh-huh, if you feel pain, okay? Or no.
Yeah. Yeah.
Okay.
Yeah. Yeah. No.
Okay. Let's go over here. Okay, that one. That's the one that was a little bit red. What about here? No. Okay, so let's do backwards. Okay, what about the two front teeth? Okay. No.
No.
Okay, I think that pretty much tells me what I need to know. Let me go ahead and write that down. That was about T5 on the top side. And when's the last last time you were at a dentist?
A month ago.
Okay, a month ago. Wow, that's good for you. Okay. Well, I would schedule a visit with that dentist, and I can also refer you to one. Do you have any history of root canals or any dental work?
I do.
Okay.
I've had about 8 cavities.
Okay, just throughout your life?
Throughout my life.
Okay, that makes sense. That's not so bad. Just make sure to brush your teeth after that Halloween candy.
Yeah.
And I only see that one tooth as a problem, and it's just, it seems that it might be hurting you intermittently now, but in the future it could turn into an issue, and it sounds like it's already giving you a bit of pain. So we're gonna stay on top of that. Okay. And while I'm up here, I'm gonna go ahead and give your scalp a quick check if that's okay. Okay. Okay, Yzzy, so I'm just going to, if you can lift your head for me gently, that would be excellent. Good. Go ahead and rest your head right here. Beautiful. Your hair is really healthy, I can tell. It's very beautiful. I'm not seeing any issues of dryness, split ends, damage. Just going to get a part here so I can inspect the scalp. Use a light scalp just to give you a brief inspection. Perfect. Just going to, I see that you have just a few nice little moles here. I'm just going to measure them and write down you have a little 2 millimeters by 2. Okay, and that is on the right cerebral hemisphere. It's not wash with the skin. I'm just going to take a paper tool, just lay it flat against the mold just to see if it's raised. No, it's completely wash with the skin right here. Okay, I'm just going to write that down. Okay, just look right here. There's a small little indentation right above the ear here. Okay. Let's see. This is 2 millimeters by 2 right here. And same size. This one's slightly raised, but it is symmetric in shape. Is that painful here when I touch?
Yes.
A little bit? Okay. Alright, what about here? Is that painful?
Yes.
Okay. I'm just going to go ahead and write that down. Okay. Now, since you mentioned pain, I'm just going to take a quick sample just to make sure that it is. Just going to take a little sample strip. Okay, just right above the ear. Okay, going to send that to the lab. Okay, I'm not noticing any redness here. Just going to take a closer look along the part. Now scaling. Just a couple of indentations, a little birthmark here, Yzzy. I'm just going to do a quick measurement. Just going to measure. That's about 1/2 centimeter, might do. Okay, let's go put that down. Okay. And a bit further down here, there's a little mark here. That is 2 millimeters by 3. Okay. Next, we're going to do just another quick sensory test similar to sharp or dull. Sharp or dull, should I say? And this one is going to be wet or cold, okay? So I have a wet sensation. Okay, here. So this will be wet. And this will be cold. Okay, close your eyes, relax. Go ahead and say wet or cold depending on which one you feel. Wet. Good. Cold. Wet. Wet. Good. Cold. Cold. Wet. Good. Cold. Cold. Good. Wet. Good. Cold. Wet. 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 Cold. Cold. Wet. Very good, okay. Now you have an area with a little bit of pain above the ears, so I'm going to just give you a little bit of foaming solution there. Okay, just gonna feel like a crackling sensation. It's gonna feel a little tingly. I think that's going to help soothe the area while we wait for the lab results and see any outward irritation. But this should help kind of ease the pain a little bit. Until then, I didn't see any signs of infection, so really no need for antibiotics at this stage. Sorry. Okay. Here and just examine the ends here. Really healthy. Your hair's growing nicely. I'm not seeing signs of damage. Just gonna check here with the light. Okay. Any issues with itchiness in the scalp? No. Okay. So, going to move on to an abdominal exam, okay? And then we'll proceed. Okay. See, I'm just going to switch gloves here. You said it was like a muscle ache?
Yes.
Okay. Both sides of the stomach?
Yes.
Okay. I'm going to gently raise your shirt just a little bit. Is that okay? Okay. Just going to examine the skin. Any issues with the belly button? Any itching?
No.
No? Okay. Your skin looks really healthy. I don't see anything red or signs of alarm. Okay. I'm going to go ahead and listen with my stethoscope. It's going to feel a little cool. Sorry about that.
Okay.
A little overactive and acidity. Okay. Sounds unnormal. Go ahead and breathe normally. Okay, I'm not hearing anything particularly concerning. Just going to do some palpations, just gently pressing down on the muscles of the stomach, just to make sure that your organs are normal in size. And let me know if you feel any sharp pain at all. Okay, so these would be your obliques. Possibly going back to your intercostal muscles. It would be consistent with repetitive trauma that would come with running, especially in a race where you're going really fast or exerting yourself. So if it's on both sides, that's a good sign actually, because it means that it is a muscular issue. Very rarely, if you're having a soreness on both sides, would that be an issue with your organs. Because your liver's over here, different things are happening, and if it's a soreness like you described, I think that's a good sign that this isn't anything very serious. And then how long did you say was going on?
It's been happening for about 3 months.
3 months. Okay, that is a little bit. That's a little long. Any nausea?
Sometimes, yes.
Sometimes, okay. I'm thinking possibly gastritis, but to be honest, since it's been going on for so long, I'd like to get some imaging done just to rule out anything major so we can focus on just what to attack.
Okay.
Most likely, it could be something like gastritis where we prescribe an acid reducer that you would take over time. Does your diet have a lot of greasy foods or fried foods?
No.
Okay. Go a little bit lower just to feel your lymph nodes here attached to your pelvis. Okay. Alright, I'm just going to do some percussions. This is going to be a little bit painful, but I want to just for you to feel if there's any. Don't feel anything hardened. Your liver feels completely normal. I don't feel... Okay. I don't feel an enlarged uterus. Don't feel any signs of fibroids, but would be probably a good idea to refer you to a gynecologist. When was your last gyna meeting?
January.
In January, and everything's normal?
Yes.
Okay, that's good to hear. Okay. So I'm going to order some imaging. Okay. Okay. And Let's go ahead with a sensory test too, just to see if you're having any signs of numbness. Just like the pressure point test, only these are fluffy little brushes. So 1 or 2, okay? Go ahead and close your eyes.
1, 2.
Is it ticklish? I'm so sorry. We'll make this brief.
1, 2.
Okay.
1, 2. 2. 1. 1, 2. 1. 1. 1. 1. 2. 2.
Okay. All right. You're very sensitive there, so I don't think you ever having any numbness. In fact, quite the opposite, which isn't a bad thing. Okay. Going to just lower this. Okay. We're going to do a quick smell test. I'm going to give you some scents to smell. Go ahead, inhale. Let me know what it smells like. If you get it close enough, that's great. News to my ears. So go ahead, close your eyes. Inhale. What does that smell like to you?
Lemon.
Perfect. That is lemon. Okay. Go ahead and inhale. What does that smell like to you?
Eucalyptus.
It's peppermint, but eucalyptus has a menthol aroma, so the two often get confused. Okay. This one's a little tricky. Go ahead, inhale.
Lavender.
It's rosemary, but at least you got an herb. So I think that's pretty good. Go ahead and inhale. What does that smell like?
Grape.
Jasmine. No one's ever said grape before. Speaking of grape, go ahead and inhale. Go ahead and tilt your head this way. And inhale. What does that smell like to you?
Can you do it again?
Yep.
Orange.
That's grapefruit, but that is pretty good as far as I'm concerned. Okay, let me see. I think I have one more. I'm not too concerned. Okay. Here's this next one. Go ahead and inhale.
I don't know. Orange.
That is definitely orange. You nailed it. I've never had such a good gray spots. Amazing work. Okay. Next, I'm going to give you a taste test. I'm just going to give you a couple strips to taste. Go ahead and open your mouth.
Close. Open.
What does that taste like to you?
Mint.
Perfect. Yes. Okay. And that's all the testing strips I have. Have you had any issues with taste or any tasting things like that aren't there?
Only when I had COVID.
I'm so sorry.
Yeah.
When was this?
This was 2 years ago.
Okay. And has your ability to taste been slightly dulled since, or dulled for a while?
It's hasn't been the same.
I'm sorry. Anything in particular that's difficult to taste for you?
Normally the soups.
Soups, do they all kind of taste the same?
Yeah.
I'm really sorry to hear that. Yeah, COVID is still being studied extensively right now, and hopefully there'll be options in the future for treatment with long COVID symptoms, but I'm glad that you're doing okay otherwise.
Thank you.
Okay. So next I'm going to take a quick gander at your feet. Okay. Any issues with your feet? Any pain or skin problems?
Yes, it hurts to walk on sometimes.
Oh, it hurts to walk. Okay. In what way is it? Are you sore?
Yes, I have very low arches.
Oh, okay, okay. Definitely can look into that and see that. Is this when you're wearing a particular type of shoe, or is it just all the time barefoot?
It's normally when I don't wear running shoes.
Okay. Don't wear shoes. Any kind of insoles that you found to be helpful?
Yes.
Okay, that's good. Just going to palpate the feet. Just feeling for any signs of swelling or reaction. I like your toenail polish color.
Thank you.
Very pretty. Let's see. Just a little bit of dryness on the soles of the feet. No redness or swelling. I'm just going to feel the ankles as well. Okay. I'm just going to measure the ankles because sometimes with pain can come swelling. You just want to make sure that there's no edema here. It's 26 on the side. That's 26. Go ahead and lift. Good. Okay, go ahead and lift your foot. Same. Okay, that's wonderful. Okay. I'm going to just do a Lipinski response test. So, very good. Oh, you're very reactive to the test. Most reactive in ASMR history. Okay. So we're going to do a similar sensory test that we did on your stomach. 1 or 2. Okay?
2.
Good. And was it on your right or your left foot?
Left.
Okay.
2.
Right or left?
Left. 1.
Right or left?
Right. 2.
Right or left?
Right. 2.
Right or left?
Both.
Good.
1.
Okay.
2.
Okay, and was that on the toes or the heels?
Toes.
Okay.
1.
Toes or heels?
Heel.
Okay.
Toes.
Okay. All right. And let me know when the vibration stops. Go ahead and say now.
Now.
Good.
Now.
Good.
Now.
Okay.
Now.
Okay.
Now.
Okay. So Yzzy, I think you are doing great. We are going to just, as a precaution, do those tests on your abdomen. We're going to schedule an MRI, possibly an ultrasound, depending on what the technician says. And what else did I say? Oh, definitely see a dentist. I'm going to refer you to a real dentist about the tooth, just to make sure that the plaque isn't progressing. It could be just an issue as simple as getting a xylitol treatment or just a cavity removed. Other than that, you're very healthy. Your vitals are excellent, and I'm very pleased with how this went today.
Thank you.
Okay, well, thank you so much for coming in. Go ahead and put your socks back on. Oops. There you go. Okay. All right, great. And we'll see you up front.